the first question is going to be to Dr. Hensley. And the question is, why is the coronavirus and flu evolving from China rather than from another continent? What are your thoughts on that?
Yeah, great question. And of course, David should also jump in here. But the first thing that I would say is that not all coronaviruses likely are evolving from China, right? We have MERS, which is a great example of evolution from the Middle East. And if you look historically and you look at the intermediate species, I'm guessing that probably OC43 also had an intermediate host in cattle. So that's a great example of one that maybe did not evolve in China. But your question is still a good question. Why do we see many new viruses evolving in China? And I think there are a number of factors there. Probably the one that is most important in my mind is the mixing of species. So it's contact with wildlife that may have new viruses that we haven't previously come into contact, but it's also where you have close contact between multiple species. So the idea, some of the farming practices, some of the contact of migratory birds with various farming practices, combined with things like the markets, I think provide a great breeding ground for viruses to find new niches, and also to allow, and for influenza and for coronaviruses, the potential for recombination to occur. David, anything you want to add to that? I know you also spent quite a bit of your talk discussing new viruses and viral evolution. Over.
Well, I would just reaffirm what you're saying, Lisa, and that is that there are coronaviruses that live everywhere. There are coronaviruses that have been found in bats in Africa. There are coronaviruses in hosts probably around the world. But it takes more than the virus being there. It takes the opportunity for it to spill over into humans, possibly repeatedly, possibly what Roger Frutos calls a circulation model of tapping on the door, viral chatter, a number of opportunities for the virus to be, for humans to be exposed to this virus coming out of a wild animal. And eventually one of those opportunities proves fateful. And with the multi-billion-dollar industry in farming of wildlife for food in China, there were an abundance of opportunities there. I don't want to demonize China. It could have happened in a lot of other places, but it's not surprising that it happened in China because the scope of the wildlife for food trade and transport.
Yeah, David, thank you for adding those. The one thing I might also add is it also requires us failing to catch it. So good surveillance. And when we fail to catch these viruses early, they're hard to put back in the bottle. And to your point, David, about other markets too, the example that I had given from the 1800s, it wasn't so long ago that many places in Europe also had similar markets right in the middle of cities. So that contact in urban areas also contributes. I know that the moderator mentioned pox viruses, but since you guys mentioned pox viruses and I spent years working on, correct, they are DNA virus. So kudos to whoever put that in the chat. I might just add there that we don't want to count pox viruses out. Certainly we're seeing some very interesting things happening with monkeypox and likely has been spreading for longer than we thought. But the good thing about pox viruses is that there do appear to be slower rates of evolution. And at least for pox viruses, we do have some medical countermeasures that seem to work broadly in that family. So let me just pass the mic back to the moderator, unless David would like to add anything else.
Thank you so much. And Dr. Notarangelo put in, he actually had a similar question, which I think you all covered here, but, he mentioned that, could you comment on human behaviors that favor the emergence of the pandemic, such as deforestation, wet markets, invasion of animal territory? So I think you all have covered that. If there's anything else you wanted to say specifically about human behaviors, and I've really learned a lot over the years with this One Health concept, where we have the intersection of environment, which then changes vectors, which then changes transmission to the reservoir, and then changes, even how the human interacts. So any other comments you might have just about human behaviors, things that we could do to avoid potentiating these things?
So a few comments I might add to that. Yes, all of what you said is 100% correct, but building on that just a little bit, certainly various social practices, looking at burials. I think, David, you mentioned filoviruses and burial practices. Those are great amplifying events that occur. Other things that I might add are sexual practices as well, and that's not to demonize anything, but one of the things that we are seeing with the monkeypox outbreak is spreads through intimate contact. So all of those types of behaviors certainly can foster. So when I think about behaviors, I think about what people do for a living, what they do in their free time. What do they do for fun? So it's a huge swath there, and certainly those behaviors can impact, create the opportunity, I think, David, as you said, for viruses to jump over, or the opportunity for them to continue to spread within a population over.
And I would add very briefly, industrial scale animal husbandry, factory farming of animals for meat. We have 26 billion chickens on this planet right now. And if you wanted a petri dish in which to passage H5N1 and perhaps turn up a strain that is capable not just of infecting humans, but human to human transmission, you couldn't ask for more than a petri dish that consisted of 26 billion chickens.
That's a scary thought.
A lot of people are watching monkeypox right now, and monkeypox deserves watching. But many of us are also watching avian flu as we get our ProMed feeds every day.
Well, before I turn, I have a question I'm going to direct to Dr. Simpson, but I have to say I was recently on a trip to Austin, and I don't know if you all are aware of that Congress Street or Congress Avenue Bridge, where there's this giant bat colony. There's actually a whole industry in Austin that, you rent a boat and you go right under and see the bats. And I have to say, I didn't do it because, I have read up on the problem, but are there certain bats that are more likely to do this, or is it the environment plus the density of people, or, why don't we see it? I mean, to me, that would be great. The next outbreak might be in Austin, Texas, for all we know. So
I'm guessing that the best answer to that is we don't know, because we haven't sampled from, there are 1,400 different species of bats. And we've focused on just a small fraction of that. Okay,
great. So there's a question for Dr. Simpson, and actually it's a good, related to a point that one of the other speakers just made. How do we get ahead of this and not just wait for something to emerge? And, Dr. Simpson talked about this concept of a multi-pronged pediatric pandemic center. And one of those prongs was related to surveillance and, constantly monitoring in focused areas that cover multiple geographic areas, so that we could get a signal for something that is going around. I guess one area where we've sort of put this to practice is with acute flaccid myelitis, which emerged, about 5-6 years ago. We saw that this was in association with emergence of certain enteroviruses. And so now there is a surveillance network where we can see when there's a surge of these particular enteroviruses, then we're kind of ready that we're looking for a surge of acute flaccid myelitis. So Joelle, do you want to comment a little bit on, that aspect of the pandemic preparedness, this concept of doing continuous surveillance? And then I have one other follow-up question for you as well from the Q&A.
Yeah, absolutely. And I think it's a great segue from the conversation that we were just having, which is also among the hubs, of course, in DC, we're such an international destination. So we never know when there's something circulating in our population. And we know that kids have different susceptibilities that, when we're doing our viral testing or whatever testing on them, in our labs, are we fairly communicating that with the other pediatric networks that we have and with our adult partners? So a surveillance network for sure, and particularly the question that was asking about, how do we continue, and this is why we have the other pillars, how do we continue to share the information learned from a surveillance network so that it becomes actionable in terms of education, policies, protocols to protect both the healthcare workforce and of course, the population at large. And I think that we, as I mentioned in my response in the chat box, that we are fortunate that I think we're growing and learning from each experience. I spoke about the example of the experience with Ebola and with Zika, and Zika in particular, as we were talking to our childbearing mothers and families in the fertility planning stages and so forth, and the impact. And that also had an international sort of surges as well. Being able to now, where I sit in terms of the communications between the research dissemination, the biosurveillance data, how you process that to communicate with the families, either to influence behavior or to deter the behaviors that continue to perpetuate the spread of this, of whatever the infection might be, is so key. Another reason why those sort of networks are important, because the communication to families, as we've learned from this pandemic, decision making, we've often seen, even acceptance of the vaccine, we've seen as the younger age groups, we have approval for their vaccine, the uptake is even lower and lower, despite all of the data and the information that's shared about it. So we have to continue to be in the loop. Hence, I'll stay on that platform for why the pediatric network in so many ways is a positive thing.
Yeah, terrific. I think you covered this in that answer. Michael Messiah, who actually was the person who right away told us this was monkeypox is a DNA virus. So I want to give him I guess it's Snickers candy bars we're handing out today for rewards. But he also asked, how does an individual facility prepare for the next pandemic if, you can't really wait for CDC or national guidance. That, of course, is very important to consolidate information and make sure it gets pushed out. But there's that phase right between when it happens. It's that first 30 days. It's kind of like the golden hour when we're taking care of an ICU patient. You've got to be ready and you can't wait for guidance. You got to just go into automatic mode. So, how do you see these potentially this pandemic center fulfilling that, first 30-day role when something has emerged?
Well, I think it's the beauty of networks, right? So beyond just even being hospitals and pediatric health systems, I think the networks with school systems, the networks with our federal partners, whether it be NIH, FDA, et cetera, and CDC, I think that, we're fortunate especially in the pediatric academic world, where we have societies like the American Academy of Pediatrics, we have all of our, infectious disease societies of America, where a lot of us, honestly, in the early days, it's texts about the one-off experiences we're having as the patients are starting to walk into our doors, and we start to share and accumulate that information. We start to develop, let's start studying, for instance, as we had the experience with MISC, what's happening. We share this information across our international borders. That is the information that all we have to rely on before the CDC is able to issue their formal information. But I think that we also are informing the CDC, and those relationships are key. Those relationships need to be established before the event occurs. And I think they're growing. I think from this pandemic, we've built those a little bit even more solidly than they were before. I think the structure and the formalities of them need to be now refined just a little bit further as we think about what is coming up next on the docket for us to fight.
That's great. Dr. Hensley just put in a nice comment. Rather than me read it, if you want to elaborate on that, because we just have about 4 or 5 more minutes, and I think it's a great point.
Sure. Thank you. One of the things that I think we miss sometimes that we don't pay, or maybe not miss, but we don't pay enough attention to what's happening in the animals, whether it's agriculture or wildlife. But when we see these large outbreaks occurring, and David's point about the avian influenza, it's something we should be paying attention to. And I think of it from 2 angles. The first is, of course, spillover. The more infections there are, the more opportunities there are for spillover to occur. But we also have to think about the impact that these infections could be occurring. So the loss of be it chicken, be it cows, the economic impact, what that can do to our food supply is another concern. And I think what most people haven't been paying attention to with the avian influenza, except for David and probably others, have been the number of chickens that have had to be culled and what that will do to the food supply and to the food costs. We're already in a situation where costs are already increasing, making it difficult for some families to afford some food. So if you pile on a major loss or depletion, that's going to drive the prices higher. So it's really important that we are paying attention to these signals in animal communities, wildlife communities, and that we think of them not only from the spillover and the risk to a virus jumping, but also to what that can do to the economy and to the availability of food for the people. Over.
Case in point, African swine fever in China in 2019. an epidemic of African swine fever virus in the pigs of China. China is the world's leading pork producer and also the world's leading pork consumer. There are some people who argue that the crash of the pork availability in China might have pushed more people to wild meat, to eating wildlife, and contributed in that way to the likelihood of the spillover of this virus.
Well, that's great. I mean, thank you so much for everyone for these great questions, and a huge thanks to the three speakers. I think this is a really nice way to end the day, bringing it up a level, looking at the bigger impact across so many different areas of our lives and across the world. So